Well, hello everyone. Welcome to our channel. We have a super special guest all the way from Saskatchewan, Dr. Natasha Gallant. Welcome, Dr. Gallant.
Thanks for having me.
Very good, very good. And we're going to focus today on dementia. And of course, I work with seniors and I'm an elder planning counselor. And Dr. Gallant specializes in that. And before we get into the interview, I just wanted to read a little something to help all of you appreciate her background. So, Dr. Natasha Gallant is an assistant professor and Canada Research Chair in Aging and Long-Term Care and director of the Aging Residents and Caregivers Research Unit with the Department of Psychology at the University of Regina. Dr. Gallant, her program of research focuses on improving the well-being of individuals who are aging with acute illness, chronic disease, and or serious mental illness. Much of her research is aimed at improving the well-being of older adults living with dementia and their caregivers. So what a wonderful background you have, Dr. Gallant. This is great. I appreciate you being here. So we're going to talk about dementia. So let me start it off here. Maybe you can help us out here. Just could you define what is dementia and perhaps the most common types of dementia?
Yeah. Yeah. So a lot of people sometimes think that dementia is Alzheimer's disease, but that's not exactly the case. Dementia is actually a whole bunch of different disorders that affect the brain and
Mm,
affect it in a specific way. So memory loss, difficulties with thinking, problem solving, language, and changes in mood or behavior. But Alzheimer's disease is actually the most common of those disorders to affect the brain. And that's why it's
yeah.
so commonly referred to.
So
So
people
that's what it is. It affects the brain. Yeah.
it affects the brain. So it's about the brain. And when we hear the term Alzheimer's, that's a form of dementia. That's the most common one. Now, when I was studying elder planning counseling, that there's a few others that are also a bit popular, right? But we don't hear
Yeah.
them as much. What would that be?
So, some of the other most common forms of dementia would be frontotemporal dementia,
Mhm.
dementia with Lewy bodies, and vascular dementia. So, those are just other kinds, but there's many different forms of it.
Yeah, yeah. It must be a very difficult time. I know I've had clients who've had to work through that, and family of clients, and working with them has been very challenging. So, what would you say? So we're talking about the onset signs. So typical onset signs that a person that they may have dementia, and how do they get confirmation of maybe the certain type of dementia? What would they do
Yeah.
when it comes to that?
Yeah, so there's some early signs, and actually, the Alzheimer's Society of Canada has a list of 10 of the top signs to look for. I'll
Hmm.
just mention a few, like if you're forgetting things often, you're struggling to remember information, you forget
Yeah.
how to do a typical routine or work, or you don't know what day of the week it is, or you're getting lost in a familiar place. These are some of the early signs.
Hmm.
Um, the way to get a diagnosis is through a healthcare professional. So
Yeah.
most likely you can go to a physician and they can provide potentially a diagnosis. Psychologists can also provide a diagnosis as well. Neuropsychologists usually more specifically.
Yeah.
Um, you don't need that full formal assessment. You can just
Mhm.
kind of get a physician diagnosis, but that would be the way of going about it.
So if someone goes to let's say they start to go to their family doctor, right?
Yeah.
Now, the family doctor is not a psychologist, right?
No. Yeah.
So would they typically give the diagnosis, or would they like to usually defer to someone else?
I think it depends on the doctor and the severity of the symptoms. I think that when the physician sees the person, there are different screening tools that we have that we can use as a psychologist, but also physicians can use and they frequently use.
Yeah.
Um, Referring every single person who might have dementia to the psychologist
Yeah.
would cause a long wait list. And so I think you will get a lot of physicians who will probably just
Yeah.
provide the diagnosis because they can
I
do
know
that.
sometimes I'll leave the living room, I'll go to the kitchen, and I stand in the kitchen and I'm like, what am I doing here? I forgot what I was going to do.
Yeah.
That's that's not a pattern of behavior, but of course my kids like to make fun of me when that
Yeah.
happens, right?
Yeah,
So
and I think, dementia is not a normal part of aging. Most people have strong memory skills way into late life.
yeah,
It's just that, yeah, sometimes we all forget things once in a while. It's when it
yeah.
becomes a pattern, like you said.
Well, that was reassuring that you said that because I'm like, that's a good one for me. So I love it. All right, so let me ask you here. So we're talking about the progression of dementia. All right. So
Mhm.
um, can you talk to us about the progression and the typical pace of decline and maybe the phases that people go through, right? What might be the
Yeah.
most significant things that might hurt or help or hinder them in that whole thing?
And I think, so like I said, dementia is that group of diseases. So they all will have their own type of progression, but
Yeah.
one of the most common ones is Alzheimer's. So I'll talk a bit more specifically to that one. Basically, it is a progressive disease. So you
Mhm.
will have the brain cells will progressively degenerate. Um, and each of those stages usually brings about different changes in a person's life and their caregivers as well. Um, and the time spent in each stage may be different for everyone. But basically, the early signs kind of come out, and people don't usually even seek a referral for an assessment until after a year of those early signs.
Yeah.
Um, the middle stage is when you kind of sort of probably have more significant symptoms. It's actually the longest stage typically. You kind of might be there for a decade, maybe even, and then the late stage is closer to probably end of life when you have significant problems with thinking and memory, etc. Um,
Wow.
yeah, and one of the things with the early stages is that that's when you want to be able to kind of um, yeah, make decisions for your future when you still
Yeah.
can.
Yeah. And we were going to talk about that. We're going to talk
Yeah.
about wills and powers of attorney soon in a bit. So, like, uh, are there signs people start like their balance? Does that impact their balance at some point where they could easily fall or?
Um, it depends, and it's possible. It's not necessarily like a clear
Okay.
connection there. But same thing, as you get older, you're more at risk of falling, and you're also more at
Yeah,
risk of getting dementia. So
that's
age kind
right.
of contributes to both. Yeah.
That's right. That's good. So, all right. So let's talk about quality of life just for a moment here. So, when we consider quality of life, like how can families adapt? So, if we talk about communication techniques as the disease progresses, kind of to maintain, because when we talk about seniors, we talk about dignity, right? We
Yeah.
talk about being connected with community, being connected with family. So, talk to us about that, about quality of life and ways that families should adapt.
Yeah, I think one of the things is that it's hard on families when someone is going
Yeah.
through dementia, right? So that progression sometimes feels like you're losing that person that you've known your whole life.
Mm,
So one of the key things is sometimes we focus on kind of keeping that person that we used to know, when
yeah,
instead we should probably be focusing on meeting the person with dementia where they are. So for
yeah,
example, person might think that they're going on their way back to work, back in the day, and they're kind
mm,
of in a different time and space. Instead of correcting them and bringing that to the present, you can sort of
yeah,
go along with it a little bit and then redirect them as needed. But trying to say, no, that's wrong. We're Tuesday, not Wednesday. That's
yeah,
not going to help. So it's really just about kind of following their pace and
yeah,
meeting them where they are instead of trying to hold on to what you remember because they're still the same person, but they are
yeah.
forgetting a lot of pieces, right?
Yeah, it's real emotionally. When I've helped some clients and who a family member's going through it, or they're a client or the
Yeah.
spouse of a client, it's emotional for me. I'll tell you, it's really challenging because you go there, they don't even recognize you anymore, and then the family member says they don't know me as their child, they don't know me as their spouse anymore,
Mhm.
and it really, really challenging. And I want to talk about the caregiver side and the family support side here for a minute. I find myself even getting emotional talking about it with you. It's quite significant. So we talk about what would be some key indicators that a primary caregiver is approaching burnout? And what preventative strategies are most effective? And I see that, so how do we deal with that? Because
Yeah.
that's real, right? That's
Yeah.
real
Yeah.
stuff.
Yeah, so those who take care of others, so an informal caregiver, will call them, they're not paid for their work. This is like
Mhm.
you're caring for a family member usually, are at higher risk of things like burnout, anxiety, depression than those who don't have that role. So there is a higher risk, I think. Um, so kind of paying attention to that and um, talking to, like, having your own support system, because
Mm,
you're
yeah.
supporting someone else. It's a lot of work. What about your
Yes.
own support system?
Yeah.
So that could be your own family, your own friends. It can be a therapist, counselor, etc. And The other piece would be to talk to a physician or another mental health professional if you
Yeah.
feel like you're at the point where it's not just kind of stress and maybe burnout anymore. It's like you're feeling like you've got some serious anxiety or depression, etc.
Yeah.
Hmm.
Because we can go, like, I know in my life, I can handle really stressful stuff for a period of time, right?
Yes, yes.
You get at a point, like if this goes on for years and years, uh, that would be quite the task, you
Yeah,
know?
so caregiving really is kind of that chronic stressor. It lasts years, and I think,
Mhm.
yeah, that's important to take care of yourself during that time. It's hard because oftentimes you're like, I don't have time to take care of myself because I have to
Yeah,
take care of the person.
that's right.
Um, so it is that balance and hopefully getting the supports you need.
Yeah.
Um,
So let's look at this situation, Dr. Gallant. Let's say husband and wife, one of them has dementia,
yeah,
the other one's a caregiver. It's been going on for months and so on. So, and they have adult children, right?
yeah.
So, what's the best, for the adult children? How can they best support the parent who's the caregiver?
Yeah, I mean, I think uh, asking what that caregiver needs,
Mm,
what they want, what they need.
mhm.
Are there ways of providing support for the person with dementia? Like, can they take over any of the roles for that
Yeah,
spouse? Is there
yeah.
anything that they can do to help? Um, and if they have the capacity to kind of seek out other services that could potentially support them,
Mhm.
do they need personal support workers? Do they need other services that might require forms and paperwork or a referral,
Yeah,
etc. Maybe that's a role for them as well. Because there's like that daily, like taking care of that person every day in and out. And then there's the other piece around just kind of the long-term thinking. And do they need, at some point, sometimes people need to go to a long-term care home. That's another
yeah.
referral. That's another piece of the puzzle. So just keeping the long-term things in mind.
Well, that's good. You kind of then my next question. So we kind of addressed some of that already throughout our time, but talk to us about, what assistance outside of one's family. So the kids can help mom or dad, but outside of the family, what kind of help or support is there? It's twofold for the person who's going through dementia or for the family who's going through a difficult time to support them.
Yeah, so for the person with dementia, physicians, there's also the Alzheimer Society of Canada. There's different
Okay.
chapters in each province and some territories. So I would reach out to them. They have
Yeah.
lots of resources. They don't have the mental health support specifically, but they have
Mhm.
support programs. Um, and then, so that's one way. There could be other things like personal support workers can help within the home, so home
Yeah.
care. Before moving to a long-term care home or to another alternative housing
Mm.
option, is there a way to keep you in the home longer? So
Yes.
that's some of the pieces there.
Yeah.
Um, and there are some support groups out there for people with dementia. And then outside of that, for the person caring for the person with dementia, the caregiver,
Yeah.
um, there's less formal supports because we have often not thought about that specific role.
Yeah.
However, um, there is more work being done there to try and help
Okay.
in providing mental health care. So there are some online kind of mental health programs or app-based supports that you could look into. And the Alzheimer's societies will also provide support for caregivers. So that's also, they have a line, helpline you can call as well. So I think that that's kind of a starting point is the Alzheimer's societies because they know the resources within the province best.
No, that's good. That's good. Now we're gonna flip it over to the estate planning side, where everyone really should have a will. They should have their powers of attorney. So if they're incapable of taking care of themselves, someone can take care of their property, finances, and their health care, right? So, but you need to have legal capacity to write those in. So 50% of people don't have a valid will in place,
Right.
right? Those are kind of the stats. So, talk to us a bit about legal capacity. So, at what point in the trajectory of this disease does an individual generally kind of lose the legal capacity, kind of to sign a legal document like a will, like a
Yeah.
power of attorney?
Yeah. So, and I think it changes depending on the province, but for
Mhm.
Ontario more specifically, um, Ontario law assumes that all adults are capable of making decisions, but you need to be able to understand information relevant to a decision and appreciate the consequences of that decision. And that's where dementia can kind of play a role here.
Yeah.
Um, and so, um, really, the best time is as early as possible. So as soon
Yeah.
as you see signs, as soon as you have a diagnosis within the early phases, that's the best time. Now, mental capacity is assessed by health professionals. So
Yeah.
if you're at a point where we're not sure if you have the capacity to like legally sign those documents,
Yeah.
then in Ontario there's a capacity assessment office. They train healthcare professionals who can do this mental capacity assessment.
Okay.
Doctors, nurses, psychologists, social workers, occupational therapists, they can all do it. Now, um, most of the time, you're really looking at the capacity to make a specific type of decision within a specific time frame. We're not typically going to say you're not capable of making any decisions,
Yeah.
and so they look at specific capacity, and it's a document that lasts like 6 months or so.
Okay.
So that would have to be done to establish that you're capable of making that decision. And recent research does show that most individuals in the early stages of dementia would not be deemed incapable. Like they would still be
Yeah.
capable.
Oh,
They
sure.
should
Yeah.
still participate in decision making. And even in the moderate stages,
Yeah.
they can still definitely express a choice, especially when it's two relatively simple options.
Mhm.
Um, so, kind of keeping that in mind. But going through a capacity assessment sounds like a lot more work than setting up a power of
It
attorney
does, it
ahead of
does
time.
sound like a bit
Yeah.
of
And
work, but it's
yeah,
important, right?
it is.
Because
Yeah.
you got to know, and you want to take care of them. And if someone dies without a valid will, it can create all kinds of other problems. And if you don't have power of attorney, and they're not able to take care of themselves, you need to have someone who can legally make decisions on their behalf.
Yeah.
Uh, but yeah, so it's
And so if
really,
you're the person with dementia in that early stage, you want to start thinking about what's important to you, learn about the different medical procedures, what they can and can't do, then decide on that substitute decision maker, and
yeah.
then talk to that person and those closest to you about your wishes and recording it, obviously, in a legal capacity would be great. Yeah.
Yeah, yeah. Well, that's good. This has been great. I just get some final thoughts here, and then we're going
Yeah.
to wrap it up. We appreciate your time, Dr. Gallant. So, let's say a family member has been diagnosed with dementia. What might be some things that they should understand or consider in helping them with realistic expectations? So, adapting to the different phases. So, if I get dementia, right? I don't know, right? Most people have no idea what they're going
Yeah.
to, right? So, help us with realistic expectations for the family, but also for the person that's going through it.
Yeah, I think, like I said, it's a, broad umbrella of diseases, but
Hmm.
typically there is a progression from, fewer symptoms to worse symptoms. I think
Yeah.
realistically thinking about getting things in order as soon as possible in case things progress quicker than we expect.
Hmm. Hmm.
But most of the time, you're still who you are. You still can make some decisions. You can still kind of voice your choices. Um, I think realistically thinking about what you would like in the future in terms of care options, like Are you comfortable with a long-term care home? Are you not comfortable with that? Making those decisions, talking to your family members about it. So realistically also thinking, can your spouse take care of you? Do you need, adult children to take care of you? Like, are they going to be able to manage that as well? I think it's tough. I think
Mhm.
making decisions ahead of time and thinking about them early is
Yeah.
helpful.
Yeah.
And the family caregiver too, there will be feelings of loss and grief
Mm.
because you are not able to be with the same like person. They're still the same person, but they're
Yeah.
different. They've forgotten things. They might have more trouble um, thinking through things. They might have changes in mood and behaviors. And so it
Yeah.
is different. It's challenging. So setting up supports for yourself as early as you can, I think, is
That's
helpful.
good. Well, I tell you, Dr. Gallant, you are a superstar in my opinion, and I really value the advice you've given us. I think it was a valuable use of our time. Anyone who listens to the end is going to find it a very valuable use of their time. So thank you very, very much. And I really appreciate this. So we'll
Yeah,
say
thanks for
goodbye to
having me.
Yeah, you're very welcome.